Hello, everyone. I am Tech Sergeant Emmanuel Rivera. I am one of the Officer Accessions recruiters for New England and Europe. Today, we may have Sergeant Branham and Master Sergeant Arnold join us. They are currently just finishing up a meeting, but you may see them pop in throughout the meeting just to listen in and potentially provide some valuable input. Today's agenda is a very brief information session that we have for the Nurse Corps. I'm just going to hit on a few accession avenues that we have for civilian, guard, and reserve applicants. Active duty personnel, you will have to get with one of us three here at the 318th to discuss the potentials of you joining the Air Force as a nurse if you are active duty, since that's a different process. We also have a special guest speaker today, Colonel Lyde. He will be chiming in today to discuss various common questions and elaborate some more upon the Nurse Corps itself, and potentially take any questions that you may have, time permitting, of course. So on this slide here, you'll see some one of the basic entryways into the Air Force as a nurse. Most nurses that have obtained their bachelor's degree or greater and have less than 12 months of experience can come into the Air Force as through the nurse transition program. And that is a program that has some of the criteria there on the left-hand side that you can see that has GPA requirements. You also have to be a licensed nurse to enter into the Air Force. Your NCLEX has to be completed. Your school has to be accredited through CCNE or the ACEN. As you can see there, a basic overview of this is we bring in a lot of the newer nurses to help become more proficient in being a nurse while in the Air Force. So there is a transition period where they kind of take you through like OJT. Some describe it as like being precepted for a longer period of time. The Air Force itself just kind of prides itself in its education, making sure everyone's trained adequately. And since everybody's clinicals is a little different, this is a great way to start into the Air Force as a clinical nurse for us.
I don't mean to say that, but
next up is one of the most common programs you hear is the Health Profession Scholarship Program. These are doctorate level programs, meaning that any nurse that would like to apply for a scholarship to one of the career fields listed here, such as CRNA, FMPs, so on and so forth. This is a way that the Air Force can pay for your education. It's a year-for-year match, minimum 3-year commitment into the Air Force. So whichever is greater there, the Air Force takes care of you through tuition assistance. And then obviously you would come online into the Air Force to be able to practice as a nurse. Next up, I just wanted to touch on the fully qualified nurses and the opportunities we have. These are the different areas of nursing. I just took some snippets here to help depict some of the criteria that you would need to be a nurse within the Air Force, given if you have that 12 months of experience or greater. One of the key things to focus on too is currently the Air Force is looking for those that has that experience within the last 3 calendar years. If it's just outside of that, case-by-case basis, we'll have to discuss to see if it is permissible for you to apply. Otherwise, they do look for that experience to be within the last 3 years. Again, 12 months or greater overall nursing. Obviously, depending on which area you would like to apply, you would have to have worked in that department at a full-time capacity, and some other details that we'll have to work out there. But for the most part, it has to be full-time bedside experience within the last 3 years. So we have clinical nursing. It's one of the main points where a lot of nurses start out within the Air Force if they do not meet the criteria for other areas to apply. From there, depending on the Air Force's manning and your overall experience, you may be able to apply into other areas within nursing in the Air Force. The other one shown here is critical care. Critical care is Colonel Lyde's one of his specialties, so you'll be hearing from him momentarily and a little bit more in depth potentially on the ICU stuff and his experiences within that. We also have the NICU as well. That is a similar criteria for applying. Another 3 categories shown here. You can kind of see for yourself some of the experiences that you will need. One of the key focus you'll notice on here is the level 1 or level 2 emergency or trauma department experience that they would look for. So please take note of that. And once again, this still continues on to being full-time bedside experience. The next two, you will see some of the criteria that they have. However, now you look at flight nursing. Flight nursing does require a little bit more experience than the other career fields, or not career fields necessarily, but shred outs, if you will. They do require a minimum of 2 years or an experience in a med surg environment. If you have experience in critical care or in the ER or something of that nature, that would potentially qualify you as a flight nurse for us from an eligibility standpoint. There is obviously further training that you would have to obtain within the Air Force if selected. All of the all of the fully qualified positions do require for you to be licensed and having no issues with your license. You also have to maintain your BLS at minimum. Some of the shred outs do require for you to have other things such as ACLS, PALS, and things of that nature. So board certifications are not a requirement for these. However, they are highly encouraged for you to pursue those if that's something that you would like to do. Lastly, we have the fully qualified positions for advanced practice nurses. Advanced practice nurses, you have to, once again, be that licensed individual with no issues on your license. You do have to have that appropriate licensure and making sure that it is valid. One of the key things to know across all nursing career fields is if you're within the Air Force and you're practicing, you only have to maintain at minimum that one licensure. You don't need to apply for every single state you may potentially be moving to within the Air Force. As long as you're practicing in the Air Force, for the Air Force, you are good to go. Just make sure that obviously you stay up to par with knowing when your licenses and certifications expire and maintaining those. So next up, I'd like to introduce Colonel Lyde. He is one of our consultants we have for critical care in the Air Force. He's worn many hats over his career, and he definitely has a wealth of knowledge that he could share with you guys today. So hopefully you can capture some of the key things that he may be able to touch on today. Posted here, you'll see some of the most common questions that we have. But at this point, I'd like to hand it over to Colonel Lyde to kind of introduce himself and just go over some of these questions and anything else he'd like to explain.
Good morning, everyone, and thank you, Son Rivera, for inviting me. Hope everyone is doing well today. As Son Rivera said, my name's Colonel Lionel Lyde, and I am my full title, as you see on the slide there, I'm the Air Force Surgeon General Consultant for Critical Care Nursing. So overall, I help the Surgeon General manage this nursing career field. And I've been a career critical care nurse throughout the Air Force. And as the slide says as well, I've deployed, I've worked in the facility, I've had the opportunity to be a commander. So I've had pretty good breadth of Air Force experience. And one of my primary duties is the accessions process. And within the accessions process, I conduct the interviews for critical care nurses that are interested in coming into the Air Force. Now, it can be, the process in and of itself can be quite lengthy, but if you're patient and things work out, then you get the opportunity to become a nurse in the Air Force. And primarily when it comes to being fully qualified, all of the information that Sergeant Rivera provided is correct. You do have to have a year experience as a nurse, plus 6 months. 6 months of that year must be critical care. Now, in reality, sometimes, depending on where you work, some of you may feel, well, that year isn't enough for me. And that's fine, You can always reapply, but then also with the pandemic, I understand that we have a lot of new graduates that have gone straight to the ICU. In some cases, I know in the state of Ohio, they were issuing provisional licenses to new graduates. It's just the demand for critical care is very high, as this pandemic has been pretty much one that has required the skills of critical care physicians and nurses. Historically, when it comes to our overall numbers, is how many critical care nurses do we have? Where are we? We have we're short. We have less than 85% of what we should have, and when it gets to that point, then we're considered critically manned. So do we need critical care nurses? Yes, we do. And we also we like to have you on the team? Yes, we would. But also, when we say fully qualified, then it comes down to your fundamental critical care knowledge, your experience. If you come in as a fully qualified critical care nurse into the Air Force, then the expectation is after you come in and you complete your officer training and you head to your first duty station, you can have an orientation on the ICU just like you would any new job in the civilian world. And after you finish your orientation, you do have some military responsibilities. You will have some military responsibilities as well because you'll be an officer in the Air Force. But the expectation is after you finish your orientation, you should be able to take care of patients independently as a fully qualified critical care nurse in the Air Force. So that's what full qualification entails in a nutshell. And those are the things that we're looking for. Now, there are a few questions on the slide here. I'm gonna jump right into those. And this is a question I do get asked by applicants. The one that says, what is the difference being an RN as a civilian versus military? Well, when it comes to clinical skill, depending on the census and the acuity of patients in the facility that you're working, i.e. how busy they are, there really isn't that much difference. There is a difference in the population that we do take care of in the military. We take care of our beneficiaries include active duty, retired, and their families. And in some areas, we also take care of VA patients or patients that are beneficiaries of the VA. So they've served previously, and we may have a sharing agreement with a VA hospital, and we will have patients. We'll see their patients in our facilities as well if their facility doesn't have an ICU. Now, in terms of what is a day like? What is a life in the day of an Air Force ICU nurse? Just like any other shift you'd work, we have morning report. We have rounds on a unit. And you may have a variety, depending on what facility you work in. We have 8 facilities that have ICUs. 3 of those facilities are large facilities. That would be Walter Reed, Brooke Army Medical Center, and David Grant Medical Center, which is at Travis Air Force Base. Now, Travis is specifically Air Force. Brooke Army Medical Center it's a joint assignment. The Army, that's an Army facility that has Air Force nurses assigned to it. And Walter Reed National Military Medical Center in the National Capital Region around Washington, D.C., that is a joint facility that's primarily run by the Navy, but the Army is there as well. And then the Air Force, we have Air Force nurses working on the ICUs in those facilities. And so with these 3 larger facilities, there are a greater variety of ICUs. They could have a surgical ICU, medical ICU, cardiovascular, and if there's an open heart program, there'll be post-op. You can take care of post-op cabbages. So some of the same things that you would do in the civilian world, we would do it here as well. Our facilities are also have received approval by Joint Commission. So we're inspected by Joint Commission just like a civilian hospital. So we pretty much line up. So, and the places that aren't like the larger facilities are either are equal to large community hospitals, or they may cover a region. I'm currently at Eglin Air Force Base, and our hospital is called Eglin Regional Hospital because we have some of our other joint service partners around the area. And in the Eglin area, we have Rangers that are being trained. We got Special Forces folks here. We have some Navy people doing explosive ordnance disposal. Their school is here. And we are the large facility in this market that they will send their people to for treatment. If they need an ICU, then we have an ICU here and we can take care of those folks. So, and the primary difference though would be your duties as an Air Force officer. So what is required of an Air Force officer? Well, what you will learn in your commissioned officer training is the immediate implication is as you're a leader. And that will be developed over time. You know, not everybody's going to walk in and be like one of our 3 or 4 stars, and you know, you have that. They all had to start somewhere. They were lieutenants at one point in time in their career. So there are opportunities to develop you as a leader throughout your career, and we have what's called professional military education. And it starts with our squadron officer school when you're a captain, our Air Command and Staff College when you're a major, and then our Air War College when you are a lieutenant colonel or colonel. And that's part of your professional military education that you will get. This is education that you have to have in order to progress in your career. Also, there's opportunities to deploy. And we provide training. We train you, of course, we're not just going to send you out there. So many of you may have heard of our critical care air transport teams, or CCAT. And that's a 3-person team. It has a critical care nurse, a respiratory therapist, and a physician. The physician can either be an internist, an emergency medicine physician, a trauma surgeon, or preferably an intensivist. We also have ground surgical teams. Those are larger teams. They handle trauma in some very austere locations. They don't fly, but they will take care of fresh trauma patients. And your role as a critical care nurse on that team is, after the initial stabilization is done, then the patient may have to await transport. So they may require, you may have to, what we call, sit on the patient until transport arrives, which means you'll have everything you need in the equipment that you can carry. And yes, you may have to run pressors in the field. We have portable ventilators. Everything that you could think of that you would have in a hospital will be portable. So there's special training that is provided for that. And the primary focus as an Air Force officer, as a critical care nurse in the Air Force, is to keep you ready to do that mission as well. So you will have your day-to-day clinical duties, your work schedule on the unit, and there will be times that you will have to go off and train to be prepared to deploy, and then you have your deployments as well. And there are other opportunities as well. There's an opportunity to attend grad school, and the Air Force will pay for it. You have to apply. You have to have a certain amount of time at your permanent duty station before you can apply. But we do have graduate programs. We have nurses that go to school to be CNSs, acute care nurse practitioners, family nurse practitioners, CRNAs, midwives. We have a pretty good spread of advanced practice nurses, and there are opportunities out there for that. We also have fellowships that you can attend. We have everything from legislative to executive fellowships if you want to broaden your scope. Those type of opportunities happen a little later on in your career. Early on in your career, the first two assignments or so, we really want to get you dialed in and get you used to the Air Force way of life and what our mission is. And you'll find that I've been doing this for I made 35 years last year, but I've been an Air Force critical care nurse since 1997, and it's been a very rewarding career. I've had a lot of opportunities to see and do a lot of extraordinary things. So it can be a lot of fun. It can be a lot of fun. I think I covered the average duty day. Now, I was trying to cover it in terms of a clinical nurse. If you ask me about my average duty day, then that's a whole other Zoom call. So we'll leave that one off of this one. Now, what do deployments look like in stateside TDYs? Now, deployments, typically in the Air Force, we deploy, our deployments are 6 months long, or 180 days, typically. It can end earlier, or sometimes you may have to stay a little longer depending on the situation at your deployed location. As far as deployments go, there's 3 roles you could fill. I mentioned CCAT, I mentioned the ground surgical team, or in the case, we pull out of Afghanistan now, but we had a hospital in Bagram, Afghanistan, where we had an ICU. So we would send nurses there to man that ICU. So you could be fulfilling your role as a clinical ICU nurse. We do have portable hospitals that we can erect at different locations. And these hospitals have to be staffed. And there may be a requirement to have a portion of that hospital dedicated to critical care. So you may be aligned to that facility as well. Now, as far as locations for deployments goes, that changes based on the operational picture. What's going on in the world? What type of things are we engaged in across the world? But I would say that for the most part, deployments give you the opportunity to learn more about the operational Air Force. You may meet people that fly airplanes or fly in the back of airplanes or work on airplanes, or you may have the opportunity to meet people that do other things like EOD, other branches of the service. It's an opportunity to really expand your knowledge of the military. And also, you'll be executing your primary mission, which would be to care for your fellow injured service members as they are executing their mission. So we support those people that go out in combat, and if they get hurt or injured and they need to serve, they need critical care, we can provide that for them downrange. The accommodations, I would say, are good. Remember, you're deployed, so it's not going to be like being at home. However, there are a lot of opportunities, morale building opportunities. If there's a USO that is on the base that you're at, you have opportunities to do that. Is there Wi-Fi? Yes, some locations there's Wi-Fi, some locations are not. So I know you're probably thinking about that. But once you really get dialed into the mission, you have opportunity to communicate with your family off and on, depending on what's going on. And it can be a very rewarding and fulfilling experience. Now, stateside TDYs, what we do as the Air Force from time to time, and I know many of you may have heard of this or are aware of the fact that in some of the states where the COVID cases have been extraordinarily high, they've called on the military for assistance. Now, the governors can activate their National Guard, but sometimes they don't have enough guardsmen to help them. So they will ask the Army or the Air Force, hey, can you send us some ICU nurses to help us out? And we'll either go into their facility and work with them, or we will erect one of our expeditionary hospitals in their parking lot as a contingency facility or as an overflow. And we will go in and we will help them. So that's called home station response, when we help out folks at home in some of the states. So that can happen. We have sent people to North Dakota. We've sent people to California. Most recently, we have sent people to El Paso and Mississippi. Because as you know, I believe it was a month or two ago, all of the facilities and the critical care beds in the state of Mississippi were maxed out. And we did have Air Force folks on the ground there helping to try to alleviate that situation. So those are the type of things that we can do. That kind of rolls into the humanitarian efforts. Now, when it comes to humanitarian, we'll either do things here in the continental United States. We do have missions that go down to Central America and other parts of the world. It's not unusual to send Air Force nurses from places in Alaska, such as Joint Base Elmendorf, to Guam or somewhere else in the Pacific to provide assistance. We will do this sometimes after a catastrophic event or some type of natural disaster. It's not, it wouldn't be, it's not unusual for us to have assets in places in the Caribbean or other parts of the world that may ask our government for help. And as far as participation, you would be tasked just like you would for deployment. So the way deployments work is there's a rotation. I mentioned this 6 months before, and I kind of left that out. Once you get to your facility and you've oriented, you'll be assigned to that particular team. These are called unit type codes or teams. And if you're going to be assigned to a CCAT, then we got to train you. You get trained. Once you're trained up and we validate that you can function as a nurse on a CCAT, then when your opportunity comes to deploy, you have a deployment window and you deploy for your 6 months and you come back. When you come back, you can be back for 12 to 18 months because there's a rotation. And then after that time which is called dwell time is over, then you could be potentially tasked again. So it's not the individual that is being tasked, it is your team that is being tasked, and you're a part of that team. So you would end up being deployed. Same thing happens for humanitarian. There may be times where the leadership will ask for volunteers, or they may just assign a team to a particular humanitarian effort. And this is our opportunity. If you're a nurse and you really enjoy being a nurse, this will be an opportunity for you to help out some people on the other side of the planet. And it can be a very rewarding experience. It leaves a very good impression, but it also helps you appreciate what we have here in our country as well. And the last question is, why did you join the Air Force as an RN, and why have you stayed? Okay, I stayed because I'm, no, but primarily I was prior to coming into the Air Force, I was an Army critical care nurse, and before that I was an enlisted medical laboratory technician. So I kind of came across nursing. I found out that it was a good fit for me. I really enjoyed being a nurse. So much so where I made the statement where I knew that being a nurse for me was my calling, and I would do it. Money has nothing to do with it. I'd be a nurse for free. So that's my perspective on being a nurse. I thoroughly enjoy what I do. I enjoy taking care of patients. I enjoy seeing the results, people getting better and helping them and their families. I joined the time that I was an Army critical care nurse. The Army was drawing down. This is even after they sent me to school to be a nurse. They said they had too many nurses. I said, okay, well, I'd received my education. I had a nursing license, and I already had a job lined up. I was already kind of working on the side anyway. And a friend of mine was a contract nurse that had been in the military before, that was getting an opportunity to come into the Air Force. I asked her about it, and I said, fine, let me talk to your recruiter. I did that, and a year later, I was in the Air Force, and I came in on a whim, and it was my objective to just do one term of service, do the initial 4 years, and be done with it. But I kind of liked it. So that's what happened. I got some really good assignments. I got to do some really, the best term I can use, I got to do some really cool things. I got to provide care for some patients in some really challenging situations because I enjoy the challenge. I received quite a bit of education in addition to what I already knew as a nurse. So my body of knowledge was expanded. I had the opportunity to be an instructor and teach critical care nurses as well. So it made me a better nurse, and the opportunity to lead clinically and also be a leader within the Air Force. So I've stayed because I've had those opportunities, and I enjoy helping others either obtain opportunities or providing opportunities. I always say I'm the nurse's nurse. So I'm all about nursing and our role in the medical team. And I try to make sure that our providers are aware of that. and that they understand what nurses bring to the table and what we bring to the mission as well. Because you can't run any facility without nursing services. We also have our technicians who are in and of who themselves are trained in nursing tasks. I had the opportunity to be actively involved in their course down in San Antonio for about 3 years. So I was able to be a part of that program academically and help with the education of our medical technicians who receive a lot of training on nursing tasks, and they work side by side with us. And some of them even have the opportunity to specialize. We have a specialist rate of our medical technicians that do critical care. So they will help you out on the unit as well. So you're not by yourself. You have other nurses, you have technicians, and we work together as a team. So that's why I've stayed. I've thoroughly enjoyed it. And your retirement is on my horizon in 2022, very soon. It's kind of bittersweet, but it's been a very rewarding career. Just like any job, it has its moments. There's the good days and there's the bad days, but I would say for the most part, the good have outweighed the bad. And I've had very good mentors as well. So that's one of the things we do. We try to do very well in the Nurse Corps is mentorship. So I think I've covered all of the questions. So sorry, Rivera, did you want me to just field some questions from participants?
Yes, sir. First, I just wanted to say thank you. That was a lot of great information there. Again, we really appreciate your time. We know you stay very busy. Most applicants don't realize that some of our consultants that we have, such as yourself, also take patients oftentimes. So it's very unique to be able to have you, especially midday throughout your duty day, to be able to come online and speak on various topics, to include the specific questions that we have here. The only other question that I did not post there that I've recently had quite a bit is if someone does not have the required experience for critical care or the ER, and they chose to come into the Air Force as a clinical nurse, how do they go about that transition, whether it be speaking with their chief nurse, or what are some of the basic steps and things they can look forward to ultimately transition into one of those areas?
Okay, so that's a good question. That's an excellent question, because not only do we get critical care nurses or have folks come in as civilians, our clinical nurses that are already in the Air Force may decide, okay, I've been a med-surg nurse for an assignment now. I want to be a critical care nurse, or I want to be an ER nurse. Well, we have a course. We have a 6-month course. It's our critical care emergency trauma nursing course. And that course, it's 6 months long. We have it in two locations. One at Brooke Army Medical Center in San Antonio. The other one is at Honor Health in Scottsdale, Arizona, not far from, what's it not far? It's near Luke Air Force Base. It's not far, it's a drive, but that's the closest facility. And at those two locations, they have 2 courses a year. That's how we train our critical care nurses and our ER nurses from amongst the nurses that are already in the Air Force. There are requirements. Say you come in as a clinical nurse, and you get assigned to you're working med-surg somewhere, and we move every 3 to 4 years. So say you're coming up on your 4th year, around 3rd year, it's getting close to time for you to move. And hopefully what should have happened, one thing I did leave out is when you process into your duty station, there is an appointment that your chief nurse, and the chief nurse will sit down with you. You can meet your chief nurse. Number 2, start doing some career planning. What do you want to do? What do you want your Air Force career to look like? Now, things happen, life happens. We get married, we have children, you change your mind, those type of things happen, but it's always good to have at least a baseline plan of what do I want my career to look like if I stay 20 years, or if I stay 30 years, or if I stay just for this initial assignment. So it's good to have a plan. That way, when you make alterations, you at least have somewhere to go, and it keeps the anxiety down. So when you get to that point where it's time to move, you would let your chief nurse know, I'm interested in going to the critical care emergency trauma nursing course. There's an application and there are requirements. If you meet the requirements, there are time on station requirements. You have to have at least 24 months. And depending on the situation, working with our Air Force Personnel Center, sometimes that can be waived, but most of the time, we'll expect you to have the 24 months time on station. You fill out the application. Once the application is filled out, then guess what? You get interviewed by me. Then we do. I'll do the interview. We'll do the interview, and then go forward from there. You go to the course for 6 months. You come back from the course. At that point, you're considered. You're not quite fully qualified yet. You have to do a few more hours once you get to your permanent duty station. And then after you finish those additional hours, then you become a fully qualified critical care nurse. You either place on a CCAT or a GST. You go for your training, and within that year, typically you will deploy after you finish the course. So that's how you become a critical care nurse if you're in another specialty. We've had nurses come from not just clinical; they've come from, they were OR nurses and they decided they wanted to transition over to critical care. We've had OB nurses become critical care nurses. If you qualify and you meet the requirements based on the application procedure, you can become an ICU nurse in the Air Force, and we'll hang on to you for a little while. So we need at least minimum 1 to 2 assignments. But what will happen is you'll like it so much you'll want to stay.
That is awesome. Thank you once again, Colonel. That's very valuable data, overall information, because that's one of the biggest things we've noticed in the past. We've had applicants that don't meet that initial eligibility to be that critical care or ER trauma nurse, but still have, that motivation to ultimately be one, and shift their focus ultimately professionally into that area. So that's really good. So that can help them have an idea of what to look forward to. So at this time, anybody on the line, feel free.
You can still get here.
I'm sorry, Colonel.
But what I meant was, if you still want to be a critical care nurse, you can still get here from there. So those are the 2 avenues that you can still get here. So if the desire is there, you can definitely become a critical care nurse in the Air Force.
Outstanding. So anybody on the line, if you have any questions, feel free to go ahead and unmute yourself. You should have the capabilities to do that. You don't need to turn on your camera. If you choose not to, that is okay. But we have a few minutes here to ask any of the questions that you may have.
Good afternoon, Colonel Lyde. My name is Benchis. Thank you for your presentation.
So thank you for joining us.
Thank you. I do have a question. Myself, I am ER trained, so I'm an ER nurse by trade, and I'm interested in going into flight nursing itself. My question is, if before we commission into the Air Force, if we are dual trained as a nurse in both ER and ICU specialty, will we have the ability to float back and forth between those different specialties within the military itself, within the Air Force specifically?
What I would say, well, the short answer would be no. And the reason why I say that is it's based on the health of that particular career field. Now, what happens on the ground at your particular hospital is up to your leadership. Say the ER is running short one day and they need to float somebody downstairs. That can happen. And I also meant to say that I also am an ER nurse as well. So I have the J identifier as well. So I have both identifiers. So, but it's, I've worked a couple of assignments as an ER nurse. So I picked up the identifier during that time. But what we try to do is keep you within that career field. But there are ER nurses that are on CCATs. You have the opportunity to do that. There are ER nurses that are on the ground surgical teams. You still have an opportunity to do that. So being an ER nurse won't keep you from those opportunities. And primarily, like I said, we'll try to, depending on where you're stationed, you'll be primarily in that clinical area that your subspecialty covers, unless for some reason during the day, like I said, like in any other hospital, if a floor is running short and we need to float somebody, that can still happen. We do have in-house nursing supervisors at some of our facilities. So does that answer the question?
That absolutely does answer my question. Thank you.
And also, I heard you mention flight nursing. That is an opportunity that is out there as well. We do need flight nurses. Now, you know, I'm not trying to give you away to the flight nurses because I'd rather have this critical care nurse myself. But we do have quite a need for flight nurses. We don't have enough of them. And they have a huge, huge mission because the Air Force is the only branch of the military that does aerovac. Nobody puts patients on airplanes and flies them around the world. We do it. Nobody else does it but us. The Air Force is the only branch of the military that does critical care air transport. And the other branches do have teams that they can stick in you know, dark corners of places to do things. But when it comes to the transport, we're not trying to brag, but we are good at it. And the survival rate has been 97% plus over the last decade, as compared to Vietnam and other previous conflicts. From the time a service member is injured to the time he gets back home and has had several surgeries to save them can be a matter of hours to days. So it's a valuable role. And when you also, I'm gonna kind of help Sergeant Rivera out here, be kind to your recruiter. Let them know what you're going to get an opportunity for a first and second choice, and make sure you have your first and second choice. If you're an ER nurse, then you have recent ICU nurse experience, and because that does happen, people do. Let your recruiter know and make sure that is included on your application, because you will interview with both myself and the ER consultant. And our sessions board, based on where the need is, say for instance, you don't get selected for ER, but the session board feels that based on your application and your interview, that you would qualify you could come as a fully qualified ICU nurse, then that can happen for you as well. So it's always wise to have two choices down on your application, but you have to let your recruiter know.
Will do. I communicate with Sergeant Rivera regularly, so I will continue to do so.
All right. If there's anybody else on the line, we'll do one last round of questions here for the Colonel, and then we'll just we'll go from there until the next time we meet. Right. It appears we don't have anybody else, Colonel Lyde. So once again, very, very appreciative of your time and all the information you provided to us today. We will be sharing this, if it's okay with you still, with the field, just so that they can get some more information on some of the accession avenues we have coming into the Air Force, and more in-depth details about the critical care nursing and ways that they can become a critical care nurse as well.
Well, thanks for the opportunity. I'm always willing to help out recruiters who are doing a lot of work out there in the field, trying to bring us the best nurses, and we're looking for the best. And we really appreciate your efforts. So thanks for the opportunity to be on day.
Thank you. Before you go, would there be a possibility to get your email in case we had any questions to reach out?
Sure. Get with Son Rivera, and he has my email, my contact information, and you can get my email address from him. And yes, you feel free to reach out. I'd be glad to share information with you.
Wonderful. Thank you so much for your time.
You're welcome.